everyone. Welcome to this live webinar. I'm so excited to have you all here again.
Yes.
For those who are joining us for the first time, welcome. And for those who have always been here, I'm happy to, see your beautiful faces again. I hope you're all doing well and keeping safe. So today's webinar is titled The Media World and COVID-19. And if you see with the whole thing happening this pandemic period, you see there's been a lot of uncertainties and people don't even know where to get stories or information from. So I figured this topic will be timely and we'll get to share experiences from people who have been exposed, who have been working, trying to gather information and cover stories around this pandemic. So as a background, for those who are joining us for the first time again, the ISMPH is a public health and media advocacy platform. What we do is to conduct health advocacy campaigns and awareness campaigns and to build capacity for the media on how to best communicate issues around public health and infectious diseases. Today, we are happy to announce our speakers. Mr. Manuel Elijah is a filmmaker and a media consultant. I know most of you will be wondering, so what is a filmmaker going to be doing here? I guess you wait and find out for yourselves. He's actually a very strong advocate for public health issues like mental health, like COVID-19 too is another one. Oops, I'm sorry, technology. Joseph is another very powerful award-winning journalist. He is in Ghana and he has been covering a lot of stories around agriculture and healthcare, especially COVID-19. So he's going to share his experiences with us today about how this exposure has influenced him or has influenced people in his society. Then Yesenu Sasetu is also another award-winning journalist in Kiss FM. She's a radio journalist and she hosts a program called The Clinic. I'll introduce them more as we go into the presentation. And I'm your humble moderator, Modesta Abugu. So I am a science communicator at the University of Florida. So I'm very happy to have all of you here. And to start the webinar, we'll be going through a few housekeeping rules. So we encourage you all to please mute yourselves. We'll take the questions after the presentation and we'll encourage you to comment using the chat feature. So to start our first, to call on our first presenter, I'll be calling on Joseph Opoku. He is, I'm sorry, give me 1 minute. Okay, so we'll be calling on Joseph Opoku. He is a radio, TV, and online journalist with a multimedia group called Joy FM. He lives in Ghana and he also publishes in myjoyonline.com as well as Joy News TV. His job involves traveling across rural Ghana and Africa to produce radio and television documentaries as well as write online stories. His work has been broadcasted and published in Ghana, USA, Germany, Egypt, Nigeria, and other countries. And over the course of his journalism career, which started just months before his 18th birthday, journalist won 9 local and international awards, including the International Federation of Agricultural Journalists Best Broadcast Video in 2018 and 2016 Best Journalist in SDGs Reporting Award by Ghana Journalists Association. Journalist trained at Cornell University, and he holds a firm conviction that the media can do more in eradicating poverty and alleviating the world's mysteries. And to even add as a side note, I also trained at Cornell University, and I'm very happy to have our director here. If you see any excitement in my face, it's because of the influence of our director, Dr. Sarah Evanja. She has been a strong advocate, and she's the one that leads all this fire in us. So I'm very happy to have you here, Sarah. So Joseph has brought world attention to challenges that farmers face and the remedies that include devastation from fall armyworm pests, which was caused to African farmers. So his stories have inspired the provision of school blocks, water, and other basic amenities to tens of thousands of communities in rural Ghana. So and today, Joseph will be sharing with us some of his experiences with covering COVID-19 story in Ghana. So Joseph, welcome. You have the floor.
Modesta, good afternoon.
and nice to meet all of you. Um, I hope everyone can hear me.
Yes, you can.
Okay, I don't exactly have a prepared slide or an outline for this particular conversation. Um, but just to get a sense, again, Modesta, how much time do I have in these moments with the introductory remarks? How much time do I have to speak?
15 minutes.
Okay, thanks very much. So, as Modesta introduced me earlier, I'm a journalist in Ghana. I report broadly on varied issues, but specifically on issues of environment and rural development as well as agriculture. That's more of my specialty. I do a lot of reports when it comes to the health sector as well, because of course, when it comes to rural development broadly, the health sector plays a major role because we've seen situations of very terrible health infrastructure in a lot of rural areas, and that has over the years negatively impacted efforts to deal with poverty in some of these areas. And so I tend to put a lot of focus on issues having to do with health as well. One of the very um, interesting things that I've sought to do in the course of my career has been, for example, to highlight challenges with the absence of adequate health facilities in rural areas, and then seek to bring some of these challenges to the attention of those in authority, those in the national capital, folks in parliament, folks at the level of the executive. And I can say that I work with a very powerful brand here in Ghana. It's called the Multimedia Group Limited. And among the organizations that are part of the Multimedia Group Limited is one called Joy FM, which is the most popular English speaking radio station in Ghana. And then we have myjoyonline.com, another very widely read news website. And then we have a TV platform called Joy News Television. So essentially, in the work that I do, I seek to bring some of those challenges with development in rural areas to the attention of those in authority, so that then some support goes to these communities that don't have the basic health infrastructure and even infrastructure when it comes to um, the provision of sanitary conditions and water and all. So essentially, that's what I do. I produce video and radio documentaries, and then I publish online as well. Um, the last few months have been very difficult trying to get the work that we do done, because in my line of work, for example, what I do is every 3 months or so, I take a tour across rural Ghana. So I step out of the national capital and I'm away for like 2 weeks, 3 weeks. Then I go film the documentaries and then I get back to the office and then I come edit the videos and put it out on television. But for the last 3, 4 months, I've not been able to do any such thing because of the restrictions that have come into being thanks to COVID-19, because everyone is trying to be extra careful about stepping out of the office and going out there to have conversations with people. And Ghana, for example, went on a lockdown in the national capital, Accra, and other hotspots for a period of 3 weeks, within which only essential workers were out there working. And even beyond that, there's still a general ban on public gatherings, which makes running around difficult and all. And over the duration when we had the lockdown, we as the media were lucky to have been classified as essential workers. So then it was possible to step out there to report on stories, monitor development. I was able to attend parliamentary sessions to report on what was happening and all. But I was deprived of having to do the core work that I give a lot of attention to in the course of my career, which is stepping out to rural areas and reporting on what's happening there. So obviously, then I had to find something else to do beyond what I was very much excited about doing. Um, but it's trying to get my work as a journalist done has taught me 3 key things over the last two months or so since COVID-19 became a key topical issue. First of all, misinformation has become a key issue trying to navigate the space. So just yesterday, we ran a story on our network in Ghana about a gentleman who has been arrested by operatives of the national security because he put out a video here in Ghana claiming that, repeating the popular rhetoric that 5G is one of the ways of promoting COVID-19 and that people should be careful with mobile telephony, even in the light of the COVID-19 spread, and went on to make a claim that COVID-19 is not real and that it's an attempt by those in authority to make money. And in fact, he went on in that video to encourage people to disrespect the restriction measures as the president had announced a few weeks ago. The video went viral on social media, and the national security operatives tracked him down. There is a law in Ghana that specifically criminalizes the spreading of false news. And so, using that, he was arrested by the national security operatives. I gather he was put before court yesterday, and that the trial would proceed in order to get him run through the process. And the state security operatives make the point that they would want to make an example of him as someone who had spread false news with regards to COVID-19 and encouraged people to disrespect the president's directives on not gathering in mass and not stepping out and all, so that then it will discourage others from doing same. So one of the key challenges, even as I have tried to do my work as a journalist reporting on the health sector and other areas over the last few months, have been trying to clear the issues about misinformation that's out there in the public with regards to COVID-19 and trying to get people to understand that the disease is real. The measures as have been announced by the Ministry of Health and other public officials is what is needed in order to help contain the situation. You know, public trust in government and state agencies and them having the confidence that these are authorities who will look out for the people broadly has waned over the years thanks to corruption and not paying attention to their plight as a people and all. And so when folks throw out such misinformation, it tends to spread fast. In Ghana, during the period when there was a lockdown, about 810 people were arrested in Ghana for flouting the lockdown as had been directed by government. And for a lot of these people, they were flouting the lockdown because they didn't believe in the severity of the disease, and they were not convinced that it's something that could possibly affect them and cause huge public health crisis. Again, it goes back to mistrust in the public health officials who are giving out the said information, which may have contributed to a certain extent to that kind of mistrust and leading to the flouting of these lockdowns and all. So that's really a key issue. Another thing that I've observed, even as the COVID-19 becomes a key issue, has been how the health infrastructure of the nation has been stretched to a very large extent as the pandemic, spreads and all. In Ghana currently, for a population of 30 million, we've recorded a little over 5,000 cases. The number of deaths, it's 24. The assumption is that the figure is very much on the high side for a country, our population. And it's been attributed to the fact that there's a lot of testing happening. More than 160,000 tests have been done over the duration, and it's out of that that about 5,000 cases have been recorded. But the main point I'm driving at is public health activities generally when it comes to other sectors and other diseases than COVID-19 have gradually ground to a halt. In Ghana, repeatedly, the problem of cerebrospinal meningitis has been a key issue. And what we've seen is that since the beginning of the year, about 43 people have died from cerebrospinal meningitis, far more than the number of people who have died of COVID-19, which currently stands at 24. But right within the media space and when it comes to education being done and all, we've seen a situation where there's more attention and there's more focus on COVID-19 than a disease like cerebrospinal meningitis, which has killed more people in this country than COVID-19 since the beginning of the year. And it goes back to how the media and everybody and public health officials are putting less attention on other diseases than COVID-19 and focusing too much on COVID-19. So we saw a situation where for a period of about 2 weeks, there was a Ministry of Health educational campaign that sought to discourage people from showing up in hospitals, even if they are not feeling well, and virtually encouraging. Excuse me, there's a bit of noise coming up in the background. I hope you can still hear me. But the point I was driving at was there was virtually a Ministry of Health campaign that had been ongoing in Ghana, encouraging people with other illnesses and sicknesses than COVID-19 not to show up in the clinic, because then outpatient departments were closed and all, because then the focus had to be on COVID-19. And some analysts have made the point that that's how come we've seen a spike in other diseases and deaths related to other diseases than COVID-19. And so then the question comes up, could the public health infrastructure have mobilized and structured itself in a way that tries to pay equal attention to the equally deadly diseases as COVID-19, so that the efforts to combat diseases like COVID-19 don't impact the other areas? So there have been concerns about immunizations not being done and warnings about the chances of diseases like polio and others increasing in the months ahead because there is too much focus on COVID-19. And for me, it's been one key lesson that we need to strengthen our emergency and public health preparedness in a way that we are dealing with the everyday diseases while we pay attention to emerging infectious diseases as well. For me, that has been the second major lesson. And in my work as a journalist, and it's one conversation that I would always have with third parties and say, COVID-19 is a big deal and it's killing people, and we need to pay attention. But let's not neglect the other issues that we've sought to highlight in the course of our work as journalists and as public health educators, so that then the other sectors don't exactly get affected. But all in all, it's been good trying to navigate this space, which is novel, no one has seen before. Just like in Nigeria and other parts of the world, the borders are closed. We've had situations of hotels and other people working in other areas losing their jobs because then we are not seeing so much of focus in those areas. And there have been conversations about how bringing in medical products and all, because we are hugely dependent on imported medical stuff like medicines and all, that could negatively impact the health to a large extent. But we're hoping that as we seek to navigate the space, equal attention will be paid to all of those areas, just as we are paying to COVID-19. And more interestingly, just to say this before then I round up, Modesta, even the food that we consume, there's been difficulties with that because lockdowns have resulted in difficulties in sending foods across and all. But then we all know that COVID-19, again, boosting your immune system through good food and all is one way to prevent being infected and surviving it. And again, we've seen less attention on issues of food security because of COVID-19. And so in the work that I do, what I've sought to do is to try to increase attention on all the other areas that are not gaining attention as COVID-19. And I hope that as public educated healthcare folks and public health educators and all, we seek to do that and put some more focus on those other areas than COVID-19 as well. Thank you.
Thank you so much, Joseph, for making that very important point. Interestingly, we held the first webinar we had was how do we manage other infectious diseases in the midst of COVID-19? And it is very good that you talk about this, because there's just been a lot of other deaths, and a lot of my friends will be like, someone died today and it's COVID-19. And they know for real that it's probably not COVID-19, but everyone is like attributing all causes of death to COVID-19. So yeah, you raise a very strong point, and I see how challenging it is for you guys as journalists. Now I'll quickly turn to Yesenu to share her own perspective. Yesenu works more on radio. So I believe that she has a different perspective on this whole thing. I think she's been working from home all the while, and it's not been the same. So yes, anyway, she's an award-winning health journalist, presently with Kiss FM Abuja. She's the host of a show called The Clinic, a weekly health show, and she is passionate about health development and dedicates her time and skill to give free health education and humanitarian services to people. So Yesenu, we are happy to have you here. Please, you have the floor.
Very much, Modesta. Can you hear me?
Yeah, can you turn on your volume a little bit?
Okay. Is this louder?
Yeah, I think yes.
Okay, good. Hi, everyone. Thank you so much for having me. INSMPH. So my name is Yechenu, even though Modesta is calling me Yesenu.
My bad, I'm sorry.
It's fine. I get it all the time. My name is Yechenu. Like she said, I'm a journalist. I'm a radio journalist, and it's one thing I think. Let me just go straight into it. I don't need to give any huge background, but one thing I would say this pandemic has taught me is that the things we thought were not possible are possible now. We're getting innovative about our approaches to how we report our stories. We're getting innovative about how to bond with even our audience. So it has been interesting, but it has been boring also. Because I am like Joseph. Joseph, nice to meet you. I hope we get to meet in Ghana maybe one of these days. Um, it has been boring because, like Joseph, I like to go out. I like to go into communities. I've done some work with Nigerian Health Watch. Chibuke and I, just before the pandemic, actually, Chibuke and I went to a community. We're planning something with Nigerian Health Watch. And it's interesting, having to go into those communities, the grassroots, where people do not have what they need, and you're getting to tell their stories. You're being their voice. You're giving them a platform to say what they have to say. So that was what was giving us life, giving me life, really. But well, the pandemic is here. We've had to innovate. I've had to look for ways to do my reporting, apart from the regular way I do it. So I had to leverage on my social networks. I had to go beyond my regular contacts and look for people that may not necessarily want to talk or do not necessarily know how to use technology, and get them to understand that even though we are locked down, you can actually tell your story. So I remember a particular story I did on pregnant women, because like Joseph mentioned, the pandemic or the coronavirus pandemic has brought to light the the weakness of our health system, just like in Ghana and Nigeria too. A lot of things, our health system is not as strong as we thought it was. We're seeing all the loopholes, even though we've been talking about it for a very long time, but the pandemic has made it very clear. I mean, every day cases are brought about and people are getting scared. Fear has been what has ruled the hearts of people. So I did a story on pregnant women surviving in this pandemic, because even though the coronavirus is here, there are a lot of other issues. And one thing has been clear: mental health has been an issue in this pandemic, because with the rise in fear, with the rise in cases, there's a rise in fear and panic. And especially people that are vulnerable, like pregnant women, like older people. So the story I did on pregnant women, getting to hear the story, getting them to tell me about their fears, getting them to tell me about what they're doing. You hear women coming down, going to the hospital, and then coming back infected. Antenatal services had to be stopped because women could not go to the hospital freely as they used to. So, and before now, we're always told if a woman does not go for antenatal care, she will have a very bad delivery. But we have had to find ways to innovate on how to take care of these pregnant women. So these pregnant women told me their stories, told me about their fears, told me about some actually delivered safely, some are still expecting and waiting to hear the good news very soon. And thankfully, I've not met someone that has lost her child or lost her life anyway, or it has been good news so far. So I would say the experience has been, 50-50. One that, yes, we're innovating, we're finding new ways to do new things or to do the things that we used to do. And but we're not getting to go out anymore freely. Everybody is very masked. As a journalist, I'm afraid if my microphone will be infected. In fact, I just got a message today talking about how you should protect your microphone. Be careful. Don't put the microphone close to your interviewee. People journalists are getting infected. It has just been, it's a whole lot of emotions around. But for me, I have been home a lot. I've worked from home. I've had to be on WhatsApp like 247 because people are sending in their stories. People are sending me voice notes. People are sending me, I'm having video interactions with people I've never met. I've had interviews all the way from the UK, a whole lot of that. So innovations has been one of it. So Modest, I'm following the questions that you sent. Now, you talked about managing misinformation. Well, one thing that has worked for me is having trusted sites. Now, I'm more interested about giving giving information that people can work with. I'm not gunning for breaking the news. A lot of some news organizations are more interested about breaking the news, who broke it first. But I am more interested in giving the story that will be beneficial to people, giving people information that will help them make informed decisions. So if there's an information on, let's say, social media or WhatsApp, Facebook or Twitter or wherever, I always make sure that until I hear it from the trusted information sites, like for this pandemic, for this coronavirus pandemic, it has to be WHO, it has to be Nigeria Center for Disease Control, or it has to be the Federal Ministry of Health. So once there's no information from those places, then I will not run with it immediately until I confirm it. So people throw information at you all the time. In fact, one of the things that is clear also in this season is infodemics. Information coming here and there. You don't know which one to trust. There's just a whole lot. You don't know which one you're supposed to go for. But I would say, if I'm talking to people, please just go to the trusted information sites. Go to the people that are in charge of giving the information. And in this case, when it comes to health, you know that it's the World Health Organization. When it comes to health for Nigeria, you know that it's the Federal Ministry of Health. Or for infectious diseases, you know, it is the Nigeria Center for Disease Control. Because even you as a journalist may not get it right all the time. So you have to go to the trusted site. So what else was it that you asked, Modesta? Well, the disease is real. It's very real. For people that feel it is not real, for people that are still thinking twice about it, please don't think twice about it. Until something comes close to you, sometimes you feel like it's still far away, it will not happen to me, or it's not happen to a member of my family. But then one day you see that it actually happens to you, or it actually happens to a member of your family. So, or someone a friend or a colleague, or someone that is close to someone. So we cannot take things for granted. I know I've earned the name health prefect in my office because before I've always been a germaphobe. I'm always telling people to wash their hands, even before now. Or I was always on people's necks to either use the sanitizer before they eat, maybe we're out, or immediately someone enters the office and I see someone carrying food. Have you washed your hands? Like I just harass them like that. So I always, I always used to be that. And it's just funny that now the pandemic has made it clear that we have to do the basic things that we're supposed to do. These are just the basic everyday things that we're supposed to do. And the pandemic is showing us now that you can't take a lot of things for granted. Um, I protect myself, even though I've been home a lot, but the few times I've had to go out, of course, it's a regular social distancing, wearing of masks, um, cleaning. When I get into the office, the times that I have to be in the office, like today I'm in the office, I'm actually in the office right now. Once I get in, I use bleach actually to clean my surfaces, get my recorder clean. I haven't interviewed anybody outside now, so but if I have to go out and if I come back, I have to do that, clean my surfaces and clean my recorder, make sure that my recorder is very clean, sanitized, well sanitized. Then, Modesta, what was it you asked again?
Yes and no. We are going to come back with a series of questions, additional questions for you from the experiences that you've shared, because you've raised actually very strong points that I would like to revisit. So thank you so much for all those points that you've talked about. Please, guys, remember to type in your questions in the chat section. We are going to come back with, we want this to be interactive. So please, we are going to call you up to engage with these journalists to hear, like they have explained, we want to hear how they have been able to deal with this situation in their various places. So now I'm going to call on the next panelist, which is Mr. Omanu Elijah. He is a filmmaker and a cinematographer, and he does a lot of editing and movie director. He has an international degree in digital storytelling from Birmingham University and cinematic filmmaking from British Council. He's a founder of Crystal Filmworks Limited, a production house that comprises of Nollywood's finest young filmmakers. He has been part of several Nollywood cinema blockbusters such as The Millions, Made in Heaven, Lord She Is, and Loud the Movie. So he has gained notable awards and recognition from AMVCA, AFRIF, Best of Nollywood Award, New York Film Festival, APFF Berlin, Germany, and so on. So before we get to you, Umano, I would like to play a short trailer of the movie that Umano produced on COVID-19. So please stay tuned. Sharing my screen now.
Some of the symptoms of COVID-19 include weakness, dry cough. If you don't anybody with the following symptoms, do want to report to the NCD. It's not what you think.
Richard, what do you think I'm thinking? Words of despair, your clothes on the floor. Like no other, it changes.
Okay, so that was a short clip about a short movie that Elijah produced recently. It's called Just One Call Away. And the movie tried to synthesize people about COVID-19. Something that I found very interesting about this short clip is that he produced this movie just before Nigerians started even having coronavirus situations, or just before the lockdown started. So I felt like he was very strategic. His timing was right. He was already promoting this awareness even before Nigerians became aware of it. So I'm going to share the YouTube link. I see people asking me the YouTube link of the main video. It's a 10 minutes short film, but it's very informative because for people who cannot maybe read newspapers, or who cannot always, listen to radios. For people who are always on YouTube, for example, the youths, people that don't pay attention to news, this is a source of information for those other people. So I was really inspired with the work that Elijah did. So Elijah, I would like to ask you, what motivated you to shoot this clip when you shot it, and how did you go about it?
Hi, Modesta. Thank you very much for having me. Feels great to be here. And thanks to everybody who are watching this right now. Can you hear me?
Yes, we can. Go on, please.
Okay. First of all, the whole idea came up when I think it was the day they announced the first case of a COVID-19 case in Nigeria. Did they announce the first case in Nigeria? So I was thinking to myself, what can we do to actually help? Because when the first case was announced, when I went around town, I realized that so many people believed, some people did not. Some people are saying it's just a trick by the government to embezzle more funds and this and this and that. So I just needed something to really make a point to the public out there and let them know that, see, this thing is actually very, very real. And I think there was something I observed when this whole COVID-19 started. I think that was when TikTok started to us all, because TikTok has been in the game for quite some time, but people were not really using TikTok like that. But as soon as this COVID-19 just came, everybody just got on TikTok. Like, everybody wants to be on TikTok. So I was telling myself, instead of me, I'm not trying to throw shades on TikTok users though, but I was talking to myself and my team, instead of me spending time on this thing, why don't we just do something that will last for a while, like something that people can actually see and be like, oh yeah, I think they got something people can get one or two things from. So we came up with a story, me and my team at Crystal Filmworks, and we swing into the next line of action, which was production and post-production. And the next time we came up with a film.
Thank you for that background. So, sometimes as people in the media, we always don't know how to so you, in the movie, you were the person conducting the interview, you were the person talking I mean, you're not a journalist, but you're a cinematography. So you kind of did both of journalism and cinematography in one movie. So that was really interesting. So how did you come about the idea of trying to combine this? Did you work with journalists, or was it just from your creativity? And how would you encourage people who are in the front line of reporting stories around public health issues? How would you encourage them to be very timely and very proactive in trying to respond to situations as they come?
Okay. First of all, I'm not an actor, I'm a filmmaker, but what really happened was that I think there was a lockdown in Nigeria at that time when we shot that film. Nobody was allowed to move, and the actors, I had to go pick them from their various houses because I'm having a federal press ID card. I can move, but they can't move. So I had to drive to each and every of the houses to pick them and bring them on set. I had to drive to Sulere, drive long distance to make sure I get everything on set. So the girl that was supposed to be the presenter, she's actually a real presenter in the Notable TV. I shared the idea with her. She was willing to do it. But on the day of shoots, she stopped picking her call. She said she can't go out because of police. There's lockdown. She won't go out. I said, yeah. We almost cut out the shoot now. We just had to do what we have to do. That was why I turned out being the presenter of the movie. Wow. And another thing I want to say to media outlets out there, we have a platform. We have a platform. So many people are looking out to us, whether you are a presenter or you are anything, or a social media influencer. People are looking out to us. So we have to use every platform we have to spread this news and let them know what is really happening out there. Because up to now, even so many people so many people are yet to believe this whole COVID-19 saga. Because somebody saw the movie and called me from an isolation camp here in Nigeria. As in, the guy is COVID-19 positive, he tested positive, and is currently undergoing treatment in Nigeria. I got several messages emailed from my DM on Instagram telling me about the film, but there was one particular comment that got me, which was the guy that tested positive to coronavirus. When I saw the comments, I was really touched. I was like, yeah, even if that was the whole essence of the film, I think I'm satisfied and I'm okay.
That is very important for us to know, because so we have a lot of questions coming up from in our chat section, and I think we should go straight ahead into these questions because they are very important questions. Sarah Evanja has asked, what role can Nollywood filmmakers play in helping debunk or address other forms of misinformation, such as those around vaccines and other science issues? Since you are very active in Nollywood, how do we play, what role can you guys play in addressing misinformation?
Okay, if you check, I think, I don't know, but I think America is what it is today because of their film industry, because the Hollywood industry, they've already painted the picture in our head that this is what America is, this is what is attainable, and this is what is not attainable. They've already painted the picture of the whole organized system in America. So in Nollywood, I think what we need to do is, not even Nollywood, in every other country, whether you're in Ghana, America, Kenya, any other country, as long as you're in the film and media business, we have a very big part to play because it's what we tell people, that's what they believe. I grew up, when I was growing up, I was watching a lot of Chinese movies and Jackie Chan. It was when I was fully grown, I realized that all those things that Jackie Chan does in film, those flying and those things are actually film trick. If I have had the privilege to meet Jackie Chan in real life, I would think maybe he's a real Superman or maybe a superhero or something like that. So film has a very big role to play in this in dishing out information, because it's the kind of picture we paint of ourselves. That's what people take of us. So we really need to any message we're putting out there has to be a real touching message that will change and transform life. The storytelling is key. People might find it difficult to read a book, but it's very easy to watch a film. So we can as well, those messages, let's try to incorporate life-changing messages and real story behind our films and behind every media publication or every media content going out there. So it will really go a long way in touching people out there.
I guess at this point, it's important to highlight how the entertainment industry and journalism, how they intertwine, because even while trying to dish out news, there's this kind of movies and stories that you've told are like content that journalists could use and promote the information that they want people to hear. So it's very important that you talk about that. We have another question from Chibuike. He said, how did you fund the short film, and what inspired you to go ahead, knowing that you might not make any income from it?
Oh, that's a very important question, because in business, in everything we do, we are always pointed towards one direction, which is return on investments. Anything you're doing that you're not making money from it, then it's not making. Nobody even wants to hear it, whether an investor or in fact, nobody wants to get involved in anything that does not bring money. You get. So when we came up with story, the scriptwriter Nzekwe Chris, he wrote the story in less than 2 hours. We got the story because we came up with the idea a day. We shot 2 days later. You get. So everything was just prompt and straight to the point. So when I wrote the story, I got the budget in my head, which was huge. Like, I can't tell you how much, but it's more than $1,000 though. So when I got the idea and so I wanted to fund it myself. And that was when they declared lockdown in Nigeria. Nobody knows how long the lockdown is going to stay. Everything was shut down in Nigeria. Nobody was working at that time. So it was just a one-off for me. I just told myself, see, I'm investing this in this, and I'm not expecting anything in return. But I believe the future of film and media is collaboration. So thank God to some of my partners partners. I called some of my guys who trust my work. They know what I can do. So they partner in the projects like Ibawa Productions and Transgraving Company. Actually help in easing the burden. So we had to split the budget 50-50, and instead of me spending like more than $1,000, I spent lesser than that because they also contributed to it, Ibawa Productions and Transcribing Company, and we were able to put it, and we were able to put this stunt. And at the end of the day, this content is not really about the money for us. We just wanted to create a mark and tell the story, and I think we're satisfied with what we've made so far.
Thank you so much, Emmanuel. We have a lot of questions for you here and a lot of people commending you. I think your colleague is jealous. He said, I didn't even know you were serious about the project when you briefed me about it. Like Michael Lennox.
Oh, yes. Okay. Shout out to Michael. Shout out to Michael Lennox. All the drone shots you saw in that movie. I forgot to mention Michael. Michael Lennox is actually a drone pilot in Lagos. The wedding photography in Lagos. Wedding photographer. He actually gave us his drone. The drone, that's flying camera, the DJI Phantom drone. Gave us for free, and that was the whole way of supporting the project.
Okay. So shout out to Michael for the brains behind the project. So Yesenu said Nollywood has your channel, my bad. Your channel said Nollywood has to research extensively about the life-changing stories they put out. It has to go beyond making money now. And Omano is a typical example of someone who is making life-changing stories. So we appreciate the work that Elijah is doing and has done. We hope that we'll be able to promote this kind of producers as much as possible. Actually, Elijah has produced more movies on, I think one is called Mustafa. It's a movie about mental health. And we know a lot of people do not know, excuse me. Where is this noise coming from? So a lot of people are not aware about how important it is to take care of your mental health. So Elijah has been on the front line. Oh my God. Okanlo, please can you mute yourself? So Elijah has been on the front.
It's not me.
You can mute the person as the admin or as the host. Just mute.
Okay, yeah, sorry about that. So Chibuike, I guess Chibuike, let me call you up to make this comment yourself. Please, I think the floor is now open for question and answers for all of our panelists. So Chibuike, please call yourself, make your comment.
Okay. Hi everyone, good afternoon. Hi Elijah.
Hello.
Yeah, okay, so thanks for answering that. And I liked what you said about, the comment you got from the guy who was in an isolation center and how that really touched you. So not everyone can say that, which is really understandable. Like they just want fulfillment from their work beyond getting profit. We understand profit is important because they have responsibilities and all, they pay bills. But beyond the profits and the business side of things, how do we encourage other creatives, filmmakers, the whole entire Hollywood industry as a whole to find ways of using their skills to make the community better, pass information. So we understand they have to make profit, but then short efforts, short films like this can really make a whole lot of difference, just like we've seen with what you've done. How do we encourage more of that? And just a short question for Joseph. Thanks for all the amazing work you're doing in Ghana as well. I just want to ask, in all your travelings around the community, trying to identify the things that are not working, and bringing them to the limelight for political leaders and other stakeholders to see. Do you also try to look out for the things that are working, like intentionally looking out for things that are working beyond all the issues and all the problems? That's just interesting. Thank you.
Well, the question was for Joseph and Elijah, please.
Elijah, yeah.
Yes. I don't know if it was clear to Elijah.
Question.
Yeah, I got it.
Okay, thanks.
Okay, thank you very much for your question, sir. Let me start with the first one, which is how do we encourage creative to go into non-profits projects, non-profitable, life-changing projects instead of the whole money thing. Okay, yeah, I get it. I got that. You know, we have two different. We have two types of people in terms of filmmaking. Some people are into the film business. Like if it's not making money, it's not making sense. Then there are some people who are into film because they just want to create an impact. You get. I won't blame the first one I mentioned, but for me personally, I think we should know when to strike the balance, and we should know how to strike a balance between making money and trying to make an impact. Because filmmaking, if you call yourself a filmmaker or you're a media personnel or you're in the face of the media, your primary purpose is to impact whether knowledge or anything is to oh, who's calling me? Your primary purpose of you being there is to fulfill purpose, which is to touch life and to so something like that. So what I'm trying to say is we should know how to strike a balance between the money thing and telling a story. It's not really about money. It's about purpose. What is your purpose? Some people came into the industry just to chase money. Some people came to the industry to create stories, life-changing stories and stuff. Like even in Hollywood, I think there are some movies. Not all movies in Hollywood are commercial movies. Some movies are highly commercial, like when you see those Marvel movies, Fast and Furious and the rest. But you see some good movies. They won't really do numbers in cinemas in America, but those movies are really emotional, life-changing stories. Like when you watch the movie, like some I've seen on Netflix lately, they are really, really movies with nice stories. So as a filmmaker or media personnel, we just like I said, we have to know when to strike the balance between chasing money and fulfilling purpose.
Thanks, Elijah. So Joseph, do you remember your question?
Thank you.
Hi, Joseph.
Can you hear me?
Yes, we can.
You would kind of have to remind me of the question. The question I had to do with non-profits and movie makers, doing more things in the public interest than making money. Is it that same question, or there was something else that was directed at me?
Yes, it was different. So I was asking, so in all your, going out the communities in Ghana, trying to find out the issues and the things that are not working, do you also look out for the things that are working, like solutions, what people are doing to make the communities better, to make the society better? Do you also look out for that?
Thank you very much. I'll get to that in a bit, but just to touch on the profit and not for profit bit. I think we can always have it two ways, where adequate investment can be done into funding projects that are aimed at educating the public and not necessarily, for the commercial purpose. So my point being that well-educated pieces can be funded that will both bring the profits and ensure that the returns come in. Movie makers, producers are folks who don't exactly, and particularly media, don't directly sell products, which is the media content, to the people. What they do is to produce the content for it to draw audiences, for advertisers to invest in. I think we need to get to a point where advertisers will be ready and willing to sink money in projects that are impactful, so that then the media will pay attention to it as well as a way to better help the public. Beyond touching on that,
Exactly. You're right.
Sure. The question about paying attention to the solutions that are working is again very important. Admittedly, when I attempted doing that at the end of the first half of last year, analyzing the content that I had churned out and looking out for what the positive stories were and what the negative stories were. And admittedly, in the end, I found that more than 75% of the content that I turned out were negative stories, and just about 25% of it focused on the solutions that actually work that can be scaled up and highlighting that as well. It is the reality of it that the media tends to focus a lot on bad news and that bad news sells compared to the very positive and the good news. But it's myself in my line of work, it's something that I've been trying to pay attention to over the last few months. That when I visit communities to tell stories about developmental challenges generally, let me look out for the solutions that are working as well and tell the stories and hope that someone else will pick it up in different communities and scale it up to better support communities. So it's a lesson we are learning going forward. And Chibuke, it's a learning curve for myself as a journalist that I'm taking very seriously every step of the way. Thank you.
Thank you very much.
I feel really inspired with the way the journalist and the filmmaker and the health communication officer, how they are agreeing on the same thing. It makes a lot of sense, and it means that we actually know ways that we can use and move ourselves forward. So I will encourage us to be very brief in answering the next set of questions, because we have a lot of people raising up their hands. So I see user's iPhone is raising up his or her hand. Please, can you introduce yourself and your question? I'm not sure who user's iPhone is. Okay, well, so we have a question. Okay.
That's Auntie Moji.
Oh, Auntie Moji, okay, Auntie Moji, welcome. Oh, so here we have our executive director, Mrs. Moji Makonjola. She is here and she's raising up her hand. Ma, please, can you make a comment?
Yes, please.
Yes.
Modesta, can you hear me?
Yes, we are happy to have you. Welcome.
Thank you very much. First, I'd like to congratulate our panelists for being very sincere in their presentation and also encouraging us to know that indeed the media has a role to play in public health, and particularly as we zero in on the pandemic. A couple of, I just want to read through some comments that are written here, and I find very interesting as part of things that we should actually be looking through, especially that Chubike came in with the word that I love using with journalists: solution. Make yourself a solution. And I'm happy that our brother from Ghana has said that he was analyzing himself and found that 75% of his stories, were negative, not one, there were stories that would criticize, and usually those are the kind of stories that would sell. But we are in a developing country, or developing continent, and so we need to be proactive. We need to see ourselves as citizens, and especially when you report health and narrowing it to public health, and you become an integral part of change. I like the fact that our young man, the filmmaker, has made such sacrifice, and I think you should cut across the fact that, you lead by example, like what my mentor, my mentee, Yechenu, is doing, which I'm very, very proud of you, is that you should lead by example, because people know you, people hear you, people see you, or people read you. So you must yourself see yourself as a material for change. And I think that would go a long way. I do not want to steal a lot of time here, but I just want to say to us that we need to share. I hope you're going to share this discussion online so that more journalists would be able to at least listen to them, and hope it will be a life-changing approach to how we do business.
Actually, we are streaming live on Facebook now. I'm sorry, we are streaming live on Facebook now. So please, you could share them.
I just hope that other people are watching. I want to say that what we write or what we broadcast as journalists has a long way to changing people's behavior. I would want us that our messages, particularly concerning COVID-19 should have a human angle story. I like the fact that Yechenu has started something with maternal health. It's important. Are we losing confidence in going to the hospitals even when we need to? Now, because anywhere you go, people say, don't go there. You'll be exposed to infection. We must be able to speak to experts, so that experts can thoroughly give us what to do for any situation. Some of our pregnant women, I can assure you, are very afraid to go for antenatal. It's just that Dechenu is lucky to have met some who are willing to go. And I think you should take this story up. Let's find out the impact of COVID-19 on other illnesses. From the ISMPH, we had, we had a write, I think we did a writing on Malaria Day, on World Malaria Day. We were checking through the news. Unlike before, when it's World Malaria Day, everybody is speaking to malaria, how to, prevent malaria, what to do, sleep under insecticide-treated nets, and the rest of it. That story was buried because of COVID-19. And we must realize that as a people, we are dealing with COVID-19. It is global, but we have diseases that are peculiar to us. Malaria is there, non-communicable diseases and other diseases. And of course, our children. We are looking at children, the impact of COVID-19 on children. And people are beginning to disaggregate the impact of COVID-19 on the economy, on health, on people's mental health, for example. And please, as journalists, speak with experts, because we are no experts in this field. Our expertise is how to write it in such a way that we are disseminating information. So I just want to ask us, I will still jump in because we still have more time, but I just want to draw our attention to the fact that we must see ourselves as partners in progress. And if you see you must be able to balance your story. You must be able to give it a human angle story, particularly when you are reporting health. And I think Yechenu also, I keep going back to her, because you already spoke about the platforms that as journalists, we must ensure that's where we get our stories. But we can go beyond that when we talk to human beings and put a human face on our story to see how they are coping with this situation. And please, please, and please do a checklist of your stories before you before you go on air or you publish them. And use experts, they're important. And if you want, we can see our network, the International Society of Media and Public Health will be more than ready to help you with experts who you can interview, who would give life to your stories. Thank you for now.
Thank you so much, Auntie Moji, for that. It feels like my mother coming in to tell me what I need to know. So thank you for that very important advice that you have for our journalists. So those raising up their hands, please, I see you. I'm going to call you up soon, but I would like us to address the questions on the chat. There is a question here for health prefects, and that's Yechenu. Said, do you think that going forward, more people will be more committed to basic hygiene?
Okay, that's from Adana. I saw the question earlier. Well, human behavior is very difficult to predict. I remember after Ebola, during Ebola, a lot of people were getting hand sanitizers. Offices and buildings placed hand sanitizers, placed hand washing basins at their doors. Banks and all that made all that available. But immediately after the Ebola crisis, everything went back to normal. I'm saying normal in inverted commas now, and life just went on as if nothing had ever happened. Now it's difficult to say if people will continue because we really cannot predict human behavior. But I would say that I'm hoping that people stick to it. So maybe a lot more people will stick to the basics. Someone is.
Yeah.
maybe a lot more people will stick to the basic hygiene, but it's unpredictable. So
there is also another question for you here from Mary Adeleke, Damian Mary Adeleke. She says, what strategic suggestion can you provide for organizations, for communications officer to reach out to partners and donors?
My favorite book in the whole world says that your works will take you before kings. I think it's just simple. Your work, what you have done, if you're truly into it, eventually you'll find that people are looking for you. But build a portfolio that will sell your market. I think that's just the basic of it. And social media is here. You have to leverage on that, not just for pictures. People go out to do the work. I don't know the kind of work you do, Mary Adeleke. I don't know the kind of work you do, but some people do projects just for the pictures. Some people just gather a few people and just take pictures just so they can show donors. No, genuinely, if you're genuinely doing what you claim to do, or what your objective is, people will look for you. And you put out those contents, people will look for you. As you apply for grants, you apply to donors, they will find you. And I'm saying this with a lot of conviction, because I know that there's a Nigerian organization here called Connected Development, and I have worked closely with them, and I know what they have been able to do because of genuinely doing the work, genuinely going out to do the work. They have been able to get a lot of grants, and they have been able to get a lot of donors to back them. So build your portfolio, make friends with the media people. I'm saying this and I'm laughing at this because there's a twist to it, but people that care, people that are into social development, like Auntie Boji mentioned, it goes beyond just writing the stories. It has to be human. There has to be human face to it. So people that really want to tell the stories of those human beings we see around, make friends with them. And if someone like me, if I see that this is what you're genuinely doing, then of course we will tell your story. And with that, you're getting media publicity, and you're getting publicity and getting donors to be interested.
Thank you so much for those words. So Techno Camon, you've been raising your hand. Sorry, I kept you waiting. So could you ask your question now?
Yes, I've already written my question, but let me put it in another form. I'm asking if there is any synergy between effective communication and journalism as to effect in public health because of this COVID-19 now.
Who would you like to direct your question to? All of the journalists?
My question is to Auntie Moji.
Okay. Auntie Moji.
Anybody that can handle public health.
Okay. Yes, thank you very much for your question. I think there's a synergy because if you're a communicator, you must at least be able to communicate before you can even work in, whether using pictures or using words or whatever platform you choose to use. So there's a synergy, and that's why it was easy for Elijah to be able to combine both. And talking specifically to public health, WHO, the World Health Organization, recognizes the importance of media and communication in public health. No matter what the scientists or the experts have discovered as a succor or the way forward or the treatment or whatever, they can communicate with themselves, but they need the media to amplify this communication, to amplify this finding. And so that's why we always say that it is the case of the chicken and the hen. Which one comes first? I think they both, they both can do the work. So it is important, public health, and that's why even these days, a lot of centers are giving grants to journalists to come study what public health is. So you understand the terminology. Even journalists now are then, venturing to acquire knowledge in public health. We have journalists who have masters in public health, who have grants in public health. And I mean, I can give myself as an example. I'm a fellow of the Centers for Disease Control, Center for Disease Control in America. And we at that point, we were invited in, and we did everything that the public health, whether you're medical, whether you're searching, whether you are tracing, so that when you understand these terminologies in your writing, you'll be able to break it down. Because if I say to you now, community infection, I mean, and I go on air and say community infection, what does that mean? I must be able to break it down so that my viewers or my listeners can understand. And until I'm knowledgeable about it myself, I can't do that extra work. So we learn health, communication, and as media, we are able to disseminate or amplify these messages. And that's why when you watch the news or you see jingles on television on public health, you tend to believe. They say, wear your mask. It's very important. Oh, physical distancing is important. Why is it important? It's the journalist that will tell you. The scientists might come in with all, and talk to you about how, the virus transfers from one person to the other. But you, as the journalist, will be able to break down that language and communicate with people. So you can see that there's a whole lot of synergy and a whole lot of operations that are going on between, the experts and the media, and of course, all around communication, information, and education. I hope that answers your question.
That's very good. On a swift move and on a more serious note, and to divert a little bit, I would like to use a resource for those who are interested in public health. The first online university that is tuition free. I would like to work with the organization so that we can make a provision for those who want to do public health, and also they have to locate who is going to be their supervisor, and also they have to also locate an institution that will be supervising them. So we'll work along that, and I will send you the format so that you can key in.
Okay, that would be wonderful, because we have been discussing with the University of Ilorin and University of Jos and other universities. We hope we'll have more discussion with them, and I'm sure this will go along.
Any university that agrees, they are going to give them a resource worth up to $500,000 US, not in cash, but in material resource and as in study materials that they are going to send online.
Fantastic.
I love this networking opportunity. We're already talking money, talking strategies, talking communication. It's very good and very important. And I mean, I'm totally enjoying myself here, and we still have a lot of questions here, but since we are running out of time, we're going to take this last few set of questions before I thank the panelists. But I want to call on Father Augustine to talk to us a little bit about his own experience. So Father is a reverend father here in Gainesville, Florida, and he works in the hospital, and he's been in contact with a lot of people who have been exposed to this COVID-19 pandemic. And as a Nigerian, he's been very strong on an advocate, a very powerful advocate about public health and health communication. So Father, please, let's have some few words from you.
Thank you. I just want to begin with a few questions to Elijah. Elijah, where do you have your office situated? Elijah.
Oh, can you hear me?
Yes. Yeah, where do you have your office situated?
Okay, I'm in Lucky Phase 1 in Lagos.
Do you pay tax for your business?
Yeah, I do.
Since you released that film, have any government official called you? Have you received any such call?
I wasn't expecting that call in the first place, and they've never done anything for me now, so I wasn't expecting that call.
That's a good news. Then, Auntie Moju, thank you so much. You really addressed the question I wanted to ask Yesenu. When you talk about going to the right platform to access your information, the people are the basic form where you can get your information. But there is another thing I want to throw up. What is fake news? Is fake news my experience or what is not available? Because so many people tend to call what is fake, what is not fake news, fake news. If I got an experience which is peculiar to me and I am sharing it, it is never a fake news. Like remember the last time we had this conference when, let me use a particular example Diane used, the toilet papers running out of Walmart. She went to a Walmart where she couldn't get it, but most of us went to a Walmart where she had it in excess, but most of us went to many Walmart where we couldn't get this. So when I said that there was no toilet paper in the Walmart, is that a fake news? No. Why am I trying to say? This is an internal body. So we still need to work on leadership. The question I have for Auntie Moju, this link, do you have any linkage with this platform with an educational system in Nigeria? This is, when we still see ourselves as a developing country, I don't even call Nigeria a developing country because we have not started developing. We are still stagnant. Stagnant in the sense that we are not even following any footstep towards development. Today, move to any part of the world, once the imbalance is moving, everybody will leave the way. But in Nigeria, once the government is moving, everybody will leave the way. Imbalance is moving, you block the road. And you don't blame the people because this is what has been given to them. But as journalists, this is where we have to also beam our light. If our leadership are not ready to work, we cannot develop. I am a priest, 8 years as a priest. I got to America. I couldn't work in the hospital until I do what a program they call CPE. The program they call CPE, I never studied this in theology. Send me back to Nigeria tomorrow, I must start it in the seminaries. Because it has revealed to me my personal self. It has given me a personal identity that if I am going into a patient's room, I am going to work with the patient. In Nigeria, we have many graduates, but we don't sit down to do what is called research. What we are doing in this platform is a serious research that at the end of this, whoever that has participated in this has an edge over anybody that have not come to this forum, because you are getting experiences from different people. And this platform, we're going to be in America, what we are doing today is a credit work. It's going to give me credit to my work, because if I present a certificate of what I have participated in, it's going to make me to have something. So when people talk about money, hard labor needs to be paid. If you are creative, if you are genuine, you need to cash out. So I don't like the idea that somebody will invest to bring, look at the movie you presented to us, everybody have commented it, and your account is running dry because our system is not working. So as journalists, I always tell journalists this, as a priest, I know my work. I don't go to the pulpit because the governor is there. I begin to readjust the truth. The problem we have, so many of us, because we are looking for money in a wrong direction. When you hit it at the right way, the money will definitely come. Just like Elijah, the movie you've shown is actually going to blow, but not today, but maybe tomorrow.
Thank you, Father, for those questions. Auntie Moji, do you have answers to him?
Yes, quickly. Thank you, Father, for I can see your passion, and I share your passion. For us on ISMPH, we are premised on improving information dissemination. So what we'll do most of the time is to build capacity around any situation that is happening. We like to trend. And that's why we have a platform here. We've done it, this will be the third that we've had since the pandemic, and we've been doing other things. So we build capacity. And it is something for me that I want it to be a legacy, because I keep saying to people, especially my professionals, that life is a continuous education. And you cannot say because you have a master's or or a PhD in mass communication, and then you don't want to improve on other things. No, it's a learning process. Life is a learning process. And so and I keep saying that, I just want to re-echo what the father has said, that we should go beyond what I can get from it. We should do what Elijah has done, and that gives hope. But I know it's not easy. People talk about poverty, you talk about this and that, but you have to make sacrifice. And when you make sacrifice in life, I tell you, it is not for nothing. I always say that, and since we have a father, a holy father with us, and I speak to speech. We could preach a bit. What you give is what you get. We on ISMPH have decided to reach out to the public, and God has been wonderful, had made it possible for us. If not, this is not free. What the young girls here are doing is not free, but it's not that it's commensurate with what we share with them, but it is the commitment of people. And until, of course, we start committing ourselves to whatever we are doing, we won't go far. I know that time is not our friend, but I'm sure this conversation will continue, and ISMPH will always create, a platform for these to continue. And more, John, we are hoping that even after the pandemic, we will still continue with this, because life is a continuum. For as long as there's life and there's ISMPH, we will continue to build on capacity for Nigerian journalists so that they see themselves as part of progress, nation building. I want a situation where I will see lots of Nigerian journalists saying no to Kwa. You know what I'm talking about. So that you're objective. Because look, the goodies of life that you're striving for will come knocking at your door. And I keep saying that with every humility. I represent those journalists who would say no to brown envelope, but will still get the goodies of life through hard work. So I thank you, Father, and I thank you, my brother, who is asking about what we do. I'm sure that Modesta and the rest of them will let you know about what we're doing. I believe it can work. I believe it's working now. That's why we have this platform. But more than anything else, I think we should network. And that's what we've created on this platform today. And I want to also congratulate my brother from Ghana. I think that's the way to go. I like the fact that you are doing self-examination, because I do that. How many stories have I done that has touched people's lives? What exactly have I written? What have I produced? In my bulletin, what has gone out? What lessons will be learned? So it's okay, you want to sell your papers, but you don't have to be too negative. You can be very objective, because truly, if there's anything that we need to start making noise about, is the fact that we must be able to improve the health systems in Nigeria. A lot of things are not working. How many of you have done any story on our laboratories in Nigeria? How many laboratories do we have that are, that can test and give adequate results? What are the bottlenecks for NCDC? How are they coping now that testing has become the trend, or will become the trend? Are we as a country prepared for it? So we have lots of stories and lots of things to do. I can only say that these next decade, health has become central, or will become central in anything we do. So let's promote health as an investment, and promoting it as an investment, let's see ourselves as investing in that which will make our country and indeed our continent better.
Thank you so much, Ma. And thank you, Father, for that important question. I think you've actually brought up a topic which is very important. And that is what everyone is echoing. And that is what exactly is fake news. Maybe we should actually plan our next webinar to be on what is fake news. Anyone in agreement, please say aye. Okay, so we have. Okay, so our next webinar will be titled "What is Fake News?" Thank you, Father, for bringing up that.
We can't hear you.
Oh, okay. So we just found a new webinar topic for next time. So Yesenu, please, I want to call you in finally to respond to these two questions that are directed at you. Please, we want you to be as brief as possible because we've run out of time. I appreciate your patience here. So the question is from Rinbret. It says, from your point of view, I know you've been involved in intervention. You've been involved in intervention in the rural communities. Do you think that effective communication has gotten to these communities? If not, what measures are being put in place for this information to get across to them?
Okay, hi, Red. From what we've been seeing so far, I wouldn't say. I think information is being put out, of course, but it's people accepting the information. Like I stated earlier, human behavior is very unpredictable. So how we put out the information also matters. I would say a lot of information has been put out, but I don't think people are fully aware of what this pandemic will do to them, especially in the communities, in the very rural of areas. When this thing started, it started with the bourgeois, it started with the elite, people that had traveled out. So even when you tell someone in the market, the person says, I did not travel, so of course it's not going to get to me. But now it is trickling down, and we're having community infections right now because people are interacting, people are going into places, people are going to the market. So I don't think people right now are fully aware of what the pandemic will do to them or what the virus will do to them if it gets to them. But information is being put out. That one is there. Information is being put out, but it's now left to people to accept and understand what the information entails.
Okay, thank you so much. Finally, Chibuike, please, I want to put you on the spot to answer this question because it's a question from Awal Ibrahim. He said, who can be a public health journalist? Chibuike, because you're a public health journalist, I would like you to answer this question, please.
To be honest, I don't know if there's a one-size-fits-all response to that. I think it's just about interest and passion. So there are two things to it. So either you have a health background and you are interested in the media. So you don't really, I know doctors who are journalists, I know pharmacists who are journalists. Myself, my background is in health sciences. I trained as a medical scientist. But after my internship, I started to follow my passion, media, ICT, and the passion for media, storytelling, photography, and the rest. You follow your passion. I think another way could be, so you have a communication background, but for one reason or the other, you just are interested in communicating about health. And I know a lot of people are like that. And Tiboji, for it, I'm not sure, but I think she's just very passionate about health, goes after it, gets all the information and communicates it really effectively. So yeah, like I say, there's not really a one-size-fits-all response to that. But to me, this is what I would say, or what I've seen from experience. Most of the people who I've worked with who are communicating health, yeah, either they have a health background and love the media, or they have a communication background, but they want to focus on health because it's something they really care about. Yeah, I think that's it.
Thank you so much, Chibuike, for that answer. And thank you all for being part of this webinar. It's been really interesting. And I think I'm actually overwhelmed with the amount of responses and involvement that has been. We have a lot of other comments coming in, but please, we encourage you all to engage with us on Twitter. This webinar is streamed live on Facebook and on Facebook, not on Instagram, but we have our Facebook account, International Society of Media and Public Health. Please feel free to contact us there, drop your questions, and we'll be sure to direct your questions to Auntie Moji and everyone who is involved. So at this point, also our Twitter account is at ISMPHNG. Please try and follow us here and we can continue this conversation. So at this point, I would like all of us to give a clap to our panelists. They did a great job and we all agree that they were really good. Thank you, Elijah. Thank you, Joseph. Thank you, Yecheno. It was really informative.
Clap for us.
Thank you, Chibike, for your input. Thank you, Father, for giving us a new life.
No, I mean our day. The day we did our own, people don't clap for us.
Oh, we did, Chibike.
Thank you, everyone. I think this has been brilliant. Thank you, everyone. And thank you, Father, and other members of the panel. I'm sure the conversation continues.
Yes, definitely. Okay, so until we see you next
time. Are we
time.
going to get a certificate?
Okay, ISMPH will plan a certificate of attendance.
Oh, so we could actually plan a training for them and give them certificates.
Yeah, that's what we'll do. We'll do one.
Okay. So until we see you next time, please stay safe. And I'm sorry, I didn't call upon you, Ada. Thank you for all the logistics and the promotion.
Oh, yes, so thank you, Ada.
Ada is my great colleague who has been promoting this event. So thank you, Ada, and thank you, Prince Will.